England's £37 billion test and trace system has not made a clear impact on the spread of the CCP virus. That's according to Parliament's Public Accounts Committee. NTD's Neil Woodrow brings us this report.
The impact of the NHS's test and trace programme is still unclear, says the Parliament's Public Accounts Committee in a new report. Chair of the committee, Labour's Meg Hillier, said, despite the unimaginable resources thrown at this project, test and trace cannot point to a measurable difference to the progress of the pandemic. Dido Harding, the executive chair of NHS Test and Trace, defends the system.
NHS Test and Trace is an absolutely essential component in the fight against COVID. We're hitting all of the targets that SAGE set us.
The committee also criticised the over-reliance on consultants working on the system, costing £1,000 a day. Harding has this reply.
80% of all of the costs in Test and Trace goes into testing. So over the course of the last 9 months, over 83 million tests have been conducted. We've reached 9.1 million people and asked them to isolate. And every single one of those people that is isolated has helped stop the spread of COVID.
I spoke with Dr. Billy Palmer of the Nuffield Trust think tank. He says some analysis suggests that contact tracing by itself has a very marginal effect. Other analysis suggests that where test and trace program is working poorly, there's a high number of cases and deaths. He says more information is needed to look at how they met the targets that they set out for themselves.
The test and trace program, they set a goal to turn around tests within 24 hours. They've consistently been missing that. The Department of Health, in trying to justify this huge expenditure, said it was to avoid future lockdowns. There's since been a second and a third lockdown.
As for what factor is having any effect, Palmer highlights some confusion in the data.
No, we don't have that evidence. So I think the research she's pointing towards that conflates not only the effect of the test and trace program, but also the changes in people's behaviours, which might have happened even if there wasn't a test and trace programs.
He believes there is an important part missing from the current test and trace system.
So they can reach people, they can phone them up, they can contact them online and say, please self-isolate. They don't have the within their controls to actually help people do that. So that's part of government's wider strategy, and that's something that we think really needs to be addressed too.
Matt Hancock says there were 1.5 million tests done yesterday, and the team has built this testing capacity from nothing a year ago. So they've done an amazing job, and I'm incredibly grateful to them. Observers say if we are to track the government's roadmap schedule, an efficient test and trace programme is needed. Neil Woodrow, NTD News.